Nurse! Nurse! Nurse, I need a nurse!
Oh, what's going on?
My sister, something's wrong with her.
Okay, let's get her in the room.
Okay. She threw up all over my car and she's breathing funny.
Okay, let's go ahead and get her in the bed.
All right, excuse me. Sister, you're okay, you're okay.
Alright, so the first thing we're going to do is elevate your head.
You're all right, sister, I'm not going anywhere.
Okay. Okay, I'm going to go ahead and set you with our vitals. Okay, so I'm going to take your blood pressure.
Okay.
Okay, while I'm doing that, you're going to get your temp. So temp is 102. Okay, your blood pressure is 88/74. Let me see, we're going to do your pulse rate.
She's breathing like she can't breathe. Something's wrong with her.
Yeah, so what was going on? What happened?
She was out mowing the lawn and she just started talking about her stomach, and then we tried to lay her down and nothing was working, and she just keeps talking about her stomach, and then she started sounding like that.
Okay, I got respirations at 11, and then I'm going to go ahead and put pulse ox on you. Let's see what your oxygen level's at. Okay, and then how long has this been lasting?
Like 20 minutes, and I looked it up on WebMD and it says that she is dying.
Okay, 85% room air, she's dying. Okay, let's see. So you said it happened when she was mowing the lawn?
Yeah.
Okay, okay, has she ever had any chest pain in the past?
No, not that I know of.
Okay, any history of heart attack or stroke?
None that I can think of. I mean, our mama had heartburn, but that's it.
Okay, we're gonna go ahead and get her hooked up on an EKG monitor, and then we're gonna go ahead and test her blood pressure, her hormones.
Oh,
Okay?
my stomach hurts
let's go
so
ahead and set
bad.
her up on that.
Do not throw up in here again.
Oh.
Okay.
Okay.
That doesn't, what does that mean?
Oh.
Okay, so I can't tell you exactly what it means. I'm gonna go talk to the doctor, let him know what's going on, and maybe we can get her hooked up with you.
Okay. You're all right, sister. They're gonna figure it out.
Okay.
Alrighty, I went ahead and talked to the doctor. So he did prescribe 4 meds for you, okay?
Okay.
So what we're gonna do first is I'm gonna give you some morphine. And I'm gonna push this through your IV. So I'm gonna push it for 4 to 5 minutes. This is gonna help you with pain and anxiety.
Okay.
So you're gonna feel it. It's gonna feel like a warm sensation going through your veins. Okay, so I'm gonna go ahead. Do you have any allergies to any meds?
No, ma'am.
No, you don't have like iodine, shellfish, and all that? Okay, so we're gonna go ahead and push your morphine, okay? Just let me know if anything's going on. This should almost be a relief to anxiety. Should be pretty quickly.
Oh, that still works fast.
Okay, good. So the next thing I'm gonna give you is I'm gonna give you 4 baby aspirins. You're just gonna kind of chew them up. This is gonna help with any clotting factors, okay? So here's that. Okay, and then the next thing is I have a nitro patch. Do you know what that is?
No, what's a nitro pack?
Okay, so it basically I'm gonna put it on either your chest or your back, and what it does is it's gonna increase your oxygen and it's going to decrease your heart rate. So it's gonna just kind of chill your heart out.
Okay.
So I'm gonna go ahead and put it on your chest, okay? Alright, so let's go ahead and do that. Okay, and so the next thing I'm gonna do is I'm just gonna give you a little bit of oxygen in your nose. And this is also going to just make sure that your heart is getting enough oxygen, okay?
Okay.
Alright, so there's that. Okay, and then, so we got our EKG going, she came in and did your troponin, right?
What's a troponin? Triphone?
So it's a hormone that's secreted by the heart.
Okay.
And it'll just like determine if she's had a heart attack within the last 14 days.
Is this what we think is happening?
We're not sure yet, that's why we're
Okay.
testing. We'll know for sure once the blood work comes back.
I told you not to mow that lawn.
I'm gonna go get our lab results and talk to the doctor, and then we'll go from there, okay?
Yes, ma'am. Thank you so much.
You're welcome.
Sisters.
Okay.
Okay.
Can you pull it out my IV?
All right. Thank you. I'm gonna set those up for the doctor to look at. Okay. Hey, Doc. Hello.
This is her lab work for 5. That's her troponin levels and her CBCs that we ran. Alright. She definitely had a heart attack.
Probably a mild one because it's not too high. Okay, give me a report.
Okay, so when I went in there, she had her temperature of 102, her blood pressure is 88 over 47, pulse is 113, 85% room air. I gave her the oxygen like you said, it's at 2 liters. And then we have 11 for her respirations. So I also gave her the morphine, aspirin, Nitro, and then the oxygen that you ordered. The morphine worked well. It reduced her anxiety. And then also elevated her thyroid.
Can you tell me what her blood pressure was again?
88 over 47.
Let's give her some more fluids, continuous, normal saline, to try to bump up her blood pressure.
Okay.
We'll increase her oxygen, but she's still not in a good range.
Okay.
But we're probably gonna keep her overnight. So
Okay, sounds good.
let's go. Knock knock. Hello, I'm your doctor.
Hello.
So your troponin levels, which are going to tell us if you have a heart attack or not, they're elevated, which means we have a mild heart attack. So we're gonna have to keep you overnight to monitor you throughout the night. We may or may not let you go home tomorrow. We're gonna try our best. But even if you do, you'll have to have continuous monitoring in case something happens. Would you be available?
Of course, I'm not the other side.
Okay. So we're going to continue you on the fluids, but we're going to add some for you to try to bring up your blood pressure. And we're going to give you some more oxygen to try to get you within a normal limits as long as you maintain your vital signs. Do you have any questions? All right, I'll leave it to you.
Okay, so what the doctor said was we're gonna hook you up to continuous saline. So I got your saline bag, so we're gonna put this in the IV, okay? So it's just gonna flow in at a slow rate, so that way you just have your fluids and your electrolytes. I'm also gonna bump up your oxygen, just 2, okay? That should help bring up your oxygen levels over there and your blood pressure. The next thing that I want to let you know is that you need to keep your head of bed elevated. It will help with keeping any kind of discomfort out of your chest. You just want your heart kind of sitting central, not laying back, okay?
Okay.
And then also, we're going to go ahead and put you on a low sodium, low cholesterol diet, and that will also help you with the blood flow to your heart, okay?
No sodium.
Yes, ma'am. I'm sorry.
Does that mean I can't eat my fried chicken anymore?
No, ma'am. So I also want to just inform you that I'm going to be in here the first hour every 15 minutes taking vitals, and your blood pressure is very important. We got to make sure that we can get that under control, okay? After that, we'll do every 30 minutes, and then if it still looks good, then we'll go to every hour, okay?
Okay.
Do y'all have any questions?
Did they say what could cause this? Was it because she mowed the lawn like you're not supposed to? I've told you a million times to let the little boy across the street do it.
So we do have, there are some risk factors involved. So some that you can't really change, so like age and stuff like that. However, do you smoke?
Well, I don't smoke cigarettes.
Okay, well, any kind of inhalation of smoke could cause that. Any kind of like severe stress can cause it. Just stuff sort of like that. So once we discharge you, we'll kind of pinpoint what your risk factors are, and we'll set you up with some kind of like moderate exercises for your heart and everything, okay? All right, so here's your call light. So if you have any questions or if anything happens, just go ahead and call it, okay?
Okay.
All right, thank you.
Knock knock. Hello, how are y'all doing today?
Better.
Better? Alright, so throughout the night, your vitals came within normal limits. Everything's looking good, so we are going to send you home today. I know being in the hospital really sucks. You're okay watching her for
Yeah,
like
I'm
a
not
week or
leaving
so?
her.
Okay, we're going to send you home with a beta blocker. You have to take this for a year. You cannot discontinue without speaking with me.
What is a beta blocker?
It is...
I forgot it.
It decreases the workload of your heart.
Okay, are you still recording? Okay, it decreases the workload of your heart, so it won't put so much strain on it. Okay, so hopefully this doesn't happen again, but you're gonna come follow up with me within a week or 2, preferably a week if you can, and that way we can see how you're doing on it. We're also gonna send you home with some cholesterol medicine that's gonna keep it lowered. It's called Crestor. That way you can maintain, and you have to stay with your diet. Okay, no sodium.
Okay.
Okay, and then we're gonna send you home with some nitro in case this happens again.
Okay.
You can take it. You take it when you first get the symptoms. Wait 5 minutes,
Okay.
and then you can take another one.
Okay.
If she's still feeling chest pain, take another one after 5 minutes, but call 911.
Okay.
We're gonna get her back up here.
Okay.
And then we're gonna send you to cardiac rehabilitation to try to strengthen your heart muscle back up, maybe from damaging it from the heart attack.
Okay.
Do you guys have any other questions before you go home?
No. You're not throwing up in my car again. I'm calling 911.
All right, if you have any questions, you can call or try to set an appointment with me in about a week.
Okay.
All right.
Thank you.
You're welcome.